The Dearborn Police Department is often sent to scenes where an individual is experiencing a mental health crisis. Recognizing that this type of situation is happening more frequently, the department partnered with Access to add a licensed mental health professional to their team. This co-responder is available for any run that involves someone that could be experiencing mental instability.
What I do is I will go out and I respond with an officer to a live event, which could be either a mental health crisis or it could be like a substance abuse situation. And we go out and I try to de-escalate a situation. I can offer some clinical expertise that maybe an officer might not be trained to do. I am a clinical therapist as well, so I can talk with people. Sometimes they're a little bit more open to speaking with somebody who may not be in uniform. I can assess a little bit better maybe what the crisis is. If it's an environmental situation where they're having issues with family or with their living environment, we can determine real quickly whether it's something that needs acute care treatment, whether they have to go to the hospital, or whether it's something that we can provide a referral and get them connected with some services outside of what they're dealing with right there.
There are many reasons why having a full-time co-responder is beneficial to a police department.
The reality is a police officer has to go from call to call to call. And a mental health professional that we have on staff now is going to be able to provide not only an immediate response if available, but in addition to that, they'll be able to provide the wraparound services and the follow-up care that you often need. You know, a well-trained clinician understands the resources that are available and have that time available to provide that to people here in the city. The increase that we've seen over the last several years since COVID, we've had a 62% increase in our mental health calls. Last year alone, we responded to almost 1,600 mental health runs. The reality is that there's a very big need for this.
Not only will the co-responder be assisting with police runs, she will also be teaching Dearborn Police personnel important skills that will enable them to better handle scenes where someone is experiencing a mental health crisis.
You know, we've had a lot of training up to this point, but having a social worker here on staff will be able to provide a lot of those trainings here in-house to make sure that as we get new officers or there's new approaches, that we are just on the cutting edge of that kind of thing as well. They've proven that a mental health professional, when available, can reduce the incarceration, can reduce the use of force, can reduce the number of injuries not only to the people that are calling but my officers. You know, between the substance abuse co-responder model that we've had for several years and now this mental health co-responder model, it really positions Dearborn to be on the front end of providing service to our community, and I'm excited for it.